Canada's long-term care homes may not be prepared for a second wave. That's according to the head of Ontario's Long-Term Care Association, who has painted a stark picture of what's to come for an independent commission investigating the spread of COVID-19 inside care homes. Advocates are now calling for immediate action to address the most pressing problem: severe staff shortages.
So far, the government has placed the onus on the long-term care homes and the providers to effectively staff up. And quite frankly, that is absurd.
And staffing up is crucial because after surviving a brutal first wave of COVID-19, the threat is back. As of today, there are 78 outbreaks at Ontario's long-term care homes, a number that has quadrupled since September 1st.
We lost hope. That's the truth. We lost hope. It's a national disgrace, quite frankly.
The Registered Nurses Association of Ontario has penned an open letter to the Prime Minister and Ontario's Premier Doug Ford. They say national standards in long-term care are urgently needed. Specifically, and most importantly, they want a minimum of 4 hours a day of nursing and personal support care for each resident.
We would not support money without strings attached. Let me be very clear. That has happened already, that jurisdictions get funding from the federal government, and we quite frankly don't even know where the money goes. So no, we want standards.
The Prime Minister says he's ready to normalize standards.
This is a moment for us to step up and reassure Canadians that their loved ones, that they themselves, as they advance in age, won't be left aside.
But still, that enforcement of policy would ultimately be up to the province.
We know that there's going to be provincial pushback. There usually is whenever the feds get involved, so to speak. However, this is an opportunity for our premiers, particularly in the provinces hit the hardest, being Quebec and Ontario, to really show the residents and, Ontarians in particular, that they are, they have a vested interest to actually change the sector. This is what we need to affect change, because as of right now, there has been slim to no accountability.
Important, too, for future generations. A new national survey has found that 60% of all Canadians have changed their opinion on living in a nursing or retirement home since the pandemic broke out. That number jumps to 70% when it comes to Canadians 65 years and older.
Completely understandable and entirely warranted with what they have seen and what continues to occur in the sector.
The Premier has yet to comment on normalizing national standards, but his government has re-implemented visitor restrictions at long-term care homes in Toronto, Peel and York, regions now battling a second wave. For City News, I'm Yazdani.